My name is Mary Brunette. I'm an addiction psychiatrist and an associate professor of psychiatry at the Geisel School of Medicine at Dartmouth. I'd like to talk with you today about 5 myths we commonly hear about quitting smoking among people with mental illness and addiction. The first myth is that people with mental illness or addiction must smoke to manage their symptoms or to avoid using substances. This is simply not true. People with mental illness do not need to smoke to manage their mental illness. People with substance use disorders do not need to smoke to avoid using substances. In fact, people with mental illness and addiction usually smoke in response to urges to smoke. They also smoke to reduce nicotine withdrawal symptoms. What is nicotine withdrawal? Nicotine is the addictive ingredient in tobacco. Regular smokers will experience withdrawal when they abruptly cut down or stop using nicotine in their tobacco. Withdrawal symptoms include craving. Withdrawal also includes upset or depressed mood, irritability, frustration, anger, anxiety, insomnia, difficulty concentrating, and restlessness. These symptoms overlap with feelings people have with their mental illness and with their addictions. Because symptoms of nicotine withdrawal and symptoms of mental illness or addiction overlap, people get confused and they think they're smoking to manage their mental illness or their substance use disorder, but actually they are smoking to address their nicotine withdrawal. I'd like to talk about the second common myth, that people with mental health or substance use disorders don't want to quit. In fact, most smokers with these disorders, they know that smoking is bad for them and they try to quit, but they have more difficulty quitting, so they feel discouraged and ambivalent. Tobacco cessation treatments improve their outcomes, and many studies show that people with mental illness and addiction respond quite well to education and motivational counseling for smoking. With motivational counseling, about half of people will move forward with a quit attempt. Another myth is that people with mental illness and addiction simply cannot quit. This just isn't true either. I've worked with many people who have mental illness and addictions who've been able to quit smoking. Many studies have shown that when smokers use cessation treatment, including counseling, nicotine replacement therapy, and medications such as bupropion or varenicline, these smokers are able to quit. However, when people try cold turkey or without treatment, they often fail. Additionally, it's important for people to get their mental illness and addiction stable before they try to quit smoking. This means that folks have only moderate symptoms and they've gotten some abstinence from their substances of abuse. The next myth I want to discuss is the concern that nicotine replacement therapy can be harmful. In fact, when you use nicotine replacement therapy as indicated in the package, it is perfectly safe. It reduces uncomfortable withdrawal symptoms while people change their smoking habit. You can watch my video on nicotine replacement therapy to hear about the details of how to use it effectively. That said, the smoke from tobacco contains thousands of toxic chemicals, some of which cause many diseases, including cardiovascular diseases, stroke, lung diseases, and diabetes. But again, it's the toxins in the smoke, not the nicotine, that's the problem. The last myth I want to talk about is the idea that only primary care providers are equipped to treat tobacco use disorder. This just isn't true. Many kinds of providers can do a great job of helping people quit smoking. Mental health and addiction providers are particularly well equipped for this. We have the most access to smokers. We have training in motivational and behavioral change strategies. Also, tobacco use disorder is a DSM-5 diagnosis, and that's what mental health and addiction providers treat. With a little education about how to do it, mental health and addiction providers can do a great job helping smokers quit. Can people with mental illness and addiction quit smoking? Yes, they can. Cessation treatment improves people's ability to quit. People with mental illness and addiction will have the most success when they use counseling, support, and nicotine replacement therapy or other medicines to quit. An integrated approach of treatment for the mental illness, the addiction, and the tobacco use disorder leads to success. So here are the facts. People with mental illness and addiction smoke in response to urges and nicotine withdrawal. When they use cessation treatment like nicotine replacement therapy to treat withdrawal, they do really well while they are quitting. People with mental illness and addiction do want to quit, but they're ambivalent and discouraged. Motivational counseling can help people get motivated and use effective cessation treatment. Nicotine replacement therapy is safe, it prevents nicotine withdrawal symptoms, and it improves people's ability to give up cigarettes and quit smoking altogether. Mental health and addiction treatment providers are well equipped to help people quit smoking. Check out my other videos on how to provide cessation treatment. Thanks for joining me today.